What if the AI your doctor used to help diagnose you was confidently, completely wrong? Not slightly off. Not a minor error. Fatally, catastrophically wrong. And what's terrifying is this is already happening right now, in real hospitals, with real patients. Let me show you exactly how dangerous this is getting. AI hallucinations are when a large language model generates information that sounds completely authoritative and detailed but is entirely fabricated. Not a glitch. Not a crash. The system keeps running, keeps sounding confident, and keeps being wrong. And in most fields, that's a problem you can fix. In medicine, that's a problem that can kill someone. In 2023, a study published in the journal JAMA Internal Medicine tested several AI systems, including versions of GPT-4 on real diagnostic cases drawn from the New England Journal of Medicine's famous case record series. These are some of the hardest diagnostic puzzles in clinical medicine. The AI systems hallucinated clinical findings, invented drug interactions that don't exist, and in several cases recommended treatment pathways that would have directly harmed the patient. GPT-4 scored around 64% accuracy on complex cases. That sounds decent until you realize a 36% error rate in diagnosis is catastrophic. To put that in perspective, a senior physician gets above 85% on those same cases. A 36% miss rate means roughly 1 in 3 complex patients gets the wrong answer. Now here's where it gets even more dangerous. The AI doesn't just give you a wrong answer. It gives you a wrong answer wrapped in flawless medical prose, complete with fake citations, invented studies, and fabricated statistics. Researchers at Stanford's Human-Centered AI Institute found in 2023 that clinicians who used AI assistants were actually more likely to miss diagnoses than those working without AI, specifically because the confident wrong answers caused what psychologists call automation bias. The human brain starts to defer to the machine. You stop second-guessing. You stop questioning. You trust the system. And the system is lying to you. In a widely reported case from 2023, a patient in the United States used an AI chatbot integrated into a telehealth platform to assess symptoms. The system failed to flag what turned out to be early-stage cardiac warning signs, classifying the symptoms as stress-related. The patient delayed seeking care. They later required emergency intervention. This is not theoretical anymore. The World Health Organization released a guidance document in 2023 specifically addressing large language model use in clinical settings, warning that premature deployment without validation frameworks poses significant patient safety risks. The FDA has approved over 500 AI-based medical devices as of 2024, but the vast majority of those are imaging tools, not diagnostic language models. The regulatory framework for LLMs in clinical decision support is, frankly, years behind the technology. Here is the core mechanism you need to understand. These models are trained to predict the next most probable token, the next word. They are not trained to be truthful. They are trained to be fluent. Fluency and accuracy are completely different things. When a model doesn't know something, it doesn't say "I don't know." It generates what a correct answer would statistically look like, and it does it with total confidence. Researchers at MIT in 2024 demonstrated that medically fine-tuned models hallucinated at lower rates than general models but still produced fabricated drug dosage information in approximately 7% of tested queries. 7% sounds small. Scale that to millions of clinical interactions and you are looking at hundreds of thousands of potentially dangerous errors. There are researchers working on solutions. Retrieval Augmented Generation, or RAG, allows models to pull from verified medical databases rather than relying purely on parametric memory. Companies like Google with MedPLM and Microsoft with Nuance DAX are building domain-specific architectures with built-in validation layers. But these systems are not yet standard. Most AI tools being marketed to clinics and hospitals today are general-purpose LLMs with a medical prompt slapped on top. So what should you actually do with this information? First, if a healthcare provider tells you AI assisted in your diagnosis, ask what validation checks were applied to that output. You have the right to know. Second, always ask for a human review of any AI-assisted diagnostic conclusion, especially for complex or serious conditions. Third, understand that AI in medicine right now is a tool to assist a skilled clinician, not replace one. The moment it's used as a replacement, you are in danger. The technology is advancing faster than the guardrails. And until those guardrails catch up, the most dangerous words in modern medicine might be, "The AI says you're fine."